Hoffman and Ole Fridtjof Norheim with us. Stephen Hoffman will present his research on the impact of the Framework Convention on tobacco control on global cigarette consumption. And he is the director of the Global Strategy Lab, a professor of global health, law, and political science at York University, and the scientific director at the Canadian Institute of Health Research of Population and Public Health. And yes, he will present his research first, and then we will have a comment and conversation with Ole Fridtjof Norheim. And then after that, we will open up for questions. And yeah, Ole Fridtjof Norheim is the director of Bergen Center for Ethics and Priority Setting, a professor at the Faculty of Medicine at the university here in Bergen. And he is also chair of the Norwegian Biotechnology Advisory Board. Yes, then we can start. Okay, great.
Right. Good morning. First, really pleased to be here in Bergen this morning. A big thank you to Professor Siri Globen for hosting this talk, much appreciated. Thank you, Professor Ole Fridtjof Norheim, for the commenting afterwards. I hope you'll be kind. I'm here today to present about did the Framework Convention on Tobacco Control reduce global cigarette consumption? It's a question that some people might say, do we need to ask it? In that, well, it's an international law, and of course we all follow laws, and international laws mean that countries are all following those types of laws. But of course, those who study law and those who study the politics of international law in particular will know that it's two separate questions as to what the law is and what effects laws might be having. And so what I'm doing today is going to be presenting a couple of papers that colleagues and I published last May in the British Medical Journal, where we were specifically gathering together the world's data around tobacco consumption, and then using that data to actually do a quasi-experimental impact evaluation of this Framework Convention on Tobacco Control, on this international treaty that's designed to reduce global tobacco consumption. I won't give you the sneak peek of our results until the end, but just raising that this is both really important from the perspective of tobacco control, which whereby this is often pointed to as the most important intervention that we have in the global fight against tobacco, which is a really important fight given that tobacco is the number one preventable risk factor for health. 8 million people dying per year, which means it's one person dying every 6 seconds. So by the time we end our time together, that's a whole lot of people. That's who will be dying. So 600 people actually will die during the course of the seminar from tobacco around the world. It's preventable, so we can actually do something about it. But also, it's really interesting, not just from the health perspective, but from an international law perspective, in the sense that this is one of the few international treaties that has a very clear outcome variable of interest. So, for example, many treaties are actually trying to address many different kinds of problems, a full range of issues, whereas it's very clear that the Framework Convention on Tobacco Control is designed and indeed motivated initially by an interest in controlling tobacco. So there's a very clear outcome variable, which then allows us to do some interesting statistical analysis and not worry, for example, about looking at various kinds of outcomes that might be trying to be achieved. So what I'll do today, briefly, is I'll run through a systematic process we went through to collect cigarette consumption data that had been collected around the world by others. I'll talk about how we use that data to perform a quasi-experimental impact evaluation. I'll talk about the implications, and then we can talk and have a good discussion. So why evaluate the Framework Convention on Tobacco Control? Here's a map, just visually. This is the shaded in areas are the 181 countries that have ratified the Framework Convention on Tobacco Control, so making this actually one of the most universally adopted treaties in the world. What that means is that this really applies to most of the world. There's a couple of countries, quite large there, that have not ratified it, but at least one of them is more or less still in line with the norms that are promulgated by this treaty. Now, the reasons to evaluate are numerous, but one is that it has been cited, as I mentioned before, as in this quote from the former Director General of the World Health Organization, Margaret Chan, she called it, quote, the most powerful tool we have to reduce the global disease burden, right? So, okay, this is a treaty that has been pointed to as having enormous importance, and of course it is, but as the most powerful tool we have to reduce global disease burden. Okay, this is power here. The second is that, as I said, there's the clear and quantifiable outcome measure, which makes it really just a great case study to look at what effects does international law have on various outcomes that we might care about. Now, if you care about global health and you care about international law, then you really care about the Framework Convention on Tobacco Control, because it is one of the few international laws that we have in global health that are specific to global health. Of course, so much is determining health, including the environment, including human rights, war, and so there's all sorts of international laws are affecting health, but very few, very, very few are focused specifically on health and coming from the health regime. And then finally, a reason to evaluate this treaty is because it actually has never been evaluated in this kind of way for its global impact. And indeed, it is actually the first quasi-experimental impact evaluation of a treaty like this. So we were quite excited about that, and we were excited when we published it. So going right to the data, basically what we did is we tried to gather tobacco consumption data for as many countries around the world as possible. And what we did is we created a threshold saying, okay, there's a lot of countries in the world, and it would probably be quite difficult to gather data from every country. And we instead decided to allocate our resources to very focused, try to do everything we can to get data from 95% of the world's tobacco consumption. And so what we did is we went through, starting at the world's largest consumers, and we were able to gather verified data for 71 countries, which represents, we met our threshold of 95% global cigarette consumption and 85% of the world's population. So that's what that means is we don't have every country in the world in this effort, but it does represent 95% of tobacco consumption. And what we did through our process was we hired an army of undergraduate research assistants. Thank you to all those students who made this possible, and indeed were co-authors on the manuscript. Basically what we did is we first went to national statistical agencies, tried to get data that government had published. We supplemented that with data from other government ministries, publications on tobacco consumption, data from intergovernmental organizations, data from non-governmental organizations. We then emailed any national statistical agency for which we could not find data. If they didn't reply to our email, we called them by phone. We found someone who spoke the local language to actually make that phone call, trying our best to get any data that might be available. And then if we still couldn't find the data, we found at least one and often several content experts within that country to try to find missing data. But then what we did is we didn't just take data at face value. We had a whole data quality appraisal process. I won't go into too much detail, but basically when bringing all the data together, we then tried to triangulate it. Did it make sense? We looked when there were some extreme changes from year to year. We tried to identify, okay, is that an evidence of maybe we shouldn't trust this data or it's not as good data? Or does that make sense in light of, for example, an economic shock in the country or some other circumstance, or closing down of the last tobacco company in that country, type of thing. And we did that, compiled this, and it's all open access. So one thing that I'm very strongly supportive of is making sure that when we generate data or bring data together, making it available to the public. So this is all available, including all of our metadata, where we describe these various factors that happened in different years to explain data, and also our own rating of the data and how much trust we should put into it. So hopefully that's a good resource for people. But why do we need this data in the first place? So for those who work in global health, you'll be familiar with the Institute for Health Metrics and Evaluation, a great research group based out of the University of Washington and really coordinating a global effort to enhance our data around both mortality as well as disease burden around the world. And so on one hand, we didn't need data because we already have it from the Institute of Health Metrics and Evaluation. They have estimates for tobacco consumption around the world. But there's a big weakness of the Institute for Health Metric and Evaluation's data, which they would agree with, which is that while they are excellent at identifying point estimates and overall trends, the data, a lot of it is modeled and accounted for missing data. And so it's smoothed over time. And so that's what that allows for is great estimates, including estimates from countries for which we don't have individual data, because they're drawing on power from regional and other predictor factors of what the data would be. But it doesn't let us do impact evaluations, because a lot of the factors that we'd be looking at, whether that has influenced the effectiveness of a certain intervention, like an international law, are actually the same factors that are going to generate the data in the first place, causing, making it that it wouldn't make sense then to do an evaluation using that data, or at least the kind of evaluation that we're doing here. So that being said, this new data was collected in order to facilitate these kind of quasi-experimental impact evaluations, whether in the global level, like what I'll be presenting today, or within countries. And yet, the good news is that our data, when it was gathered, it does overall align with what the Institute for Health Metrics and Evaluation found, which for us was a bit of a sense of, okay, that's a validity check, because our data aligns with this great work that had been done, yet additionally allows us to do quasi-experimental evaluations. And so what you'll see here is the IHME data, the Institute for Health Metrics Evaluation data, is the thinner lines. I guess it's not as easy to see on the slide. It's easier to see in the paper. The thicker lines are our data. And overall, the key thing is that it mostly accords, but one is smoother and one has some discontinuities. And indeed, it's those discontinuities that we're hoping to take advantage of in our quasi-experimental analysis. So when thinking of the impact that an international treaty like the Framework Convention on Tobacco Control could have, the first thing I think we have to do is think of a logic model, thinking about, okay, how is it possible that this treaty could change the normative or social, legal environment in which it's operating in order to have downstream effects that might reduce tobacco consumption? And so here was our model that we came up with, whereby it was developed based on actually various theoretical traditions. But the idea was that, okay, international laws don't just have effects on tobacco consumption merely because 181 countries say it should. And so the idea was, though, that treaties can have effects in many different ways. And so, for example, treaties can have effects on global political pressures, on agenda setting, providing powerful legal language that might then influence government policy change, might also influence industry change, either maybe through trade pressures or actually through government policy change itself in different countries, which in turn would influence both tobacco supply and demand for tobacco, and then lead to tobacco consumption. But then when you think of like how more granularly, how does an international treaty have effects? Like, okay, it's all it is on one hand are a bunch of words written on a page or pixels on a screen. But actually, of course, that's much more than that, right? So what is that then? And so theoretically, there's at least three, just to simplify, there's at least three different kind of effects that international laws could have, which could then lead us to the start of that cascading logic model that I showed on the previous slide. One is it could have socialization effects. So the Framework Convention on Tobacco Control, its greatest power, might have actually been the power of the process. So this is a treaty that was called for in 1995. Negotiations really got serious in 1999 when Gro Harlem Brundtland, Norway's former prime minister, became the Director General of the World Health Organization. And then that power of the process maybe is what would have allowed it to have effects, forgetting about the actual document and the norms it might have created or the legal effects. That's the first option. The second is normative effects. So maybe that there was a process, but maybe what matters is the fact that this instrument represents the views of 181 countries, and those norms in turn shape the socially constructed worlds in which we're living and in which people want to be in alignment with. So the treaty adoption might have been the key critical moment. Or third, we might have legal effects, whereby, okay, it's not just the process, it's not just the norms, but the fact that these norms are actually legally binding on countries and presumably are linked to a broader international legal system, which might then give it its effects. Now, in reality, the hope would be that a treaty like this one would have effects across all three, combined effects. We, in advance, thought that the greatest effects, based on the literature, would probably be the normative effects, but we also took stock of the others, and indeed, later I'll share, we did robustness checks to make sure in our model that we were accounting for the other options as well. Before I run through the data and our impact evaluation, I just wanted to really clarify that when we're bringing a lens to whether the Framework Convention on Tobacco Control has had an impact, we're definitely not questioning whether tobacco control laws at a domestic level or other kind of policies have an impact. There are thousands of studies proving over and over again tobacco control laws work, particularly taxes. Number one recommendation I give to anyone who asks, taxes. It's the number one way to reduce tobacco consumption, particularly for the many countries that don't have sufficiently high taxes. WHO estimates it's about 90% of countries have taxes that are way too low for changing affordability in countries. So yes, the tobacco controls laws work when they're implemented at the national level. And indeed, these are the laws and policies that are, many of them are promoted within the Framework Convention on Tobacco Control. What we're doing is questioning whether the Framework Convention on Tobacco Control has actually had its effect on encouraging the adoption of these policies in order to then reduce tobacco consumption. We don't ourselves look at the policies, but presumably if the Framework Convention on Tobacco Control has actually been able to reduce tobacco consumption, it's probably because it's been able to spur additional action on these very effective tobacco control laws that have been proven over and over and over again to work very well in reducing tobacco consumption. So what does global consumption look like? So here's our data presented both the global level, that's the thick purple line, as well as we divided up by region, geographically, OECD members, non-OECD. And this is actually the real story. Here's, we could have stopped here in a sense, because just based on the human eye looking at this, what you'll see is, in some respects, first it's a good news. So tobacco consumption, per capita tobacco consumption is going down. Almost everywhere. So good news story. Maybe the not so good news story, or the thing that you can also notice, is interesting that what changed after the Framework Convention on Tobacco Control. So that's represented by this dotted line here. And what you'll see is during the 70s and 80s, a rapid decline in per capita tobacco consumption, rapid decline, but then it's pretty consistent. And indeed, when looking just with your human eye, it sort of seems like maybe our progress is slowing down. And actually, I think based on this, the slowing down, and because we divided up in the way we did, it's so clear, in some respects, we could have just stopped here and said, well, you'd expect that a new intervention, which some have called the most powerful tool we have against reducing the burden of chronic disease, if it hasn't actually changed any sort of pre-existing trend line, probably hasn't worked, or at least hasn't worked as much as we would like. But of course, if I just presented this data and told you that, look, no big change, there's no big drop or no further reduction after 2003, which is where this dotted line is, you would probably not trust me. So instead what we did is we ran all sorts of analyses. Actually, we did our best. Our goal was, can we find a statistical effect? And so that's sort of the kicker, in the sense that the question around this presentation is, did it have effects? We tried our best to find an effect after we saw this data, because our view was that doesn't look like there has been such effect, but maybe there has been. Maybe we just can't detect it with the human eye, or maybe it's so small, but still important enough that we should do everything we can to try to find that effect. And so one thing just to flag is that as part of this analysis plan, which I'll go to in the next slide, what we tried to also do is try to track not just looking at this timeline of the global tobacco consumption, not just when the treaty was adopted, but some other important events that might have influenced this along the way. But after the treaty, really about ratifying, before the treaty, many other possible interventions. Part of this was to say that, okay, there's many things happening that explain why, for example, there might have been a drop, or if there had been more of a drop, but also to highlight that globally, when you're thinking of the global tobacco control effort, there's actually many different ways in which we can go about trying to address tobacco control and how to promote it. And there's many things that happened before the Framework Convention on Tobacco Control. So these are political choices that we make and we have made in our world about how to address these kind of challenges. That's really important to think about. So we did not one quasi-experimental analysis, we actually did two, both because they have different strengths and weaknesses and also because we really wanted to try to find an effect if we could. So the first analysis was an interrupted time series analysis. This is essentially, just to build some intuition around how this works, it's really that, okay, we're assuming, like all statistical tests like this, that our null hypothesis is that, in this case, the Framework Convention on Tobacco Control has not accelerated a previously existing decline in global cigarette consumption. Essentially, we're looking for a change in either the level of consumption or the slope before and after the Framework Convention was adopted. And so data was non-stationary, so we used first differencing in the analysis so that we were really testing for year-over-year changes. And so just to show you the data, what we'd be looking for is there, after the Framework Convention on Tobacco Control, is there a change in the previously existing trend line of declining cigarette consumption? And so if there was a change either in the slope or in the level, you might be able to attribute that to the Framework Convention on Tobacco Control. In this case, there is actually a jump. And there is actually a change in the slope. It's just going in the wrong way. It's going in the way we wouldn't want it to go. Now, this is not a statistically significant jump or change in slope. So basically our conclusion from this test overall is globally, no, we can't reject the null hypothesis, so we can't find an effect. But what this did allow us to do was look actually within different countries and provide a bit of a global landscape, which I'll talk about in a second. What we did, just for those who are more quantitatively inclined, we did all sorts of robustness checks. We actually did 25 robustness checks on this model. We also did 25 on the next model. We did 52 different analyses. And so what we found, or what we did is we said not just looking at 2003, we were looking at, okay, was there a socialization effect of the treaty? Was there a normative effect, a legal effect? And then we tried to compose the data differently. So for example, China, such a big country, a little bit of an outlier in its trends, was China driving the analysis? And indeed, actually, it was in some respects, but when you remove China from the sample, you actually get the exact same results. So in that respect, it wasn't actually driving the finding, even if it was driving some of the numbers earlier on, but not the finding. And then we also removed countries that have divided since 1970 because created complexities in the model. Same effect, same results, that we found. The second thing we did is because we might not trust just the one method of quasi-experimental analysis. There's some weaknesses, which I'll go to in a second. Let's try a second way of doing it. So we actually developed this approach called in-sample forecast event modeling. We didn't invent it from scratch. This is actually a method that's sometimes used to evaluate the effects of different events on the stock prices. And so essentially, it's very similar to what we did with the interrupted time series analysis, but instead of just looking at a linear time trend before and after the intervention, so basically, as I said before, we were looking for a change in slope and level. Instead of just like taking a ruler and drawing a line from before the intervention to after, what this does is it's actually modeling what the post-intervention period would look like in light of associations that outcome variable has to various variables before the intervention. So basically, we built a model using various economic variables, political system variables, human development variables, and other variables. We developed a model, very high R squared of 0.945. That's an adjusted R squared for those quantitatively inclined. So highly explained pre-intervention or highly predicted what tobacco consumption would be. We then extrapolated that data out beyond the intervention period and then had an ability to compare it to what we actually saw. And this is what you then get. So the blue line is what we would have predicted in light of these various variables. So what you can see is that the prediction, our model, very much matches the actual tobacco consumption data represented by the red dots. So the model fit very nicely. But then what we do is we then continue the prediction afterwards, and we are then able to compare it to what we actually saw. And so again, overall, we do see some change, but not big enough that it's beyond our confidence intervals. And although it's the extent that there is a change, it's again in the wrong direction that we would want to see. But this actually, what's interesting then is, okay, so again, we couldn't find an effect for the Framework Convention on Tobacco Control. But this is only the start of the story in a sense, because again, what it allows us to do is look regionally into different country groupings. And so this null global effect, interestingly, but also quite scarily, masks some regional effects, which we did find. So the tragic thing, I think, about our finding is that first, null global effect, which is not very exciting, especially for those who invested so much time and effort into this instrument. But what we find is actually maybe even a little worse, in the sense that if you divide up between high-income countries on the left, low- and middle-income countries on the right, basically what you find is that actually, yeah, based on our model, we would have predicted per capita tobacco consumption to actually slightly increase in high-income countries. Yet, we found a statistically significant decrease in per capita tobacco consumption in high-income countries. The challenge is, when you look at low- and middle-income countries, it's actually exactly the opposite, in that we would have predicted a slight decline, and actually found a slight increase. And it is also statistically significantly different. And just to confirm, what that means just from a numbers perspective is that high-income countries have reduced tobacco consumption by over 1,000 cigarettes per person per year compared to what we would have predicted. Whereas in low- and middle-income countries, there has been increased consumption by 500 cigarettes per year per person, more than we would have otherwise predicted. Moving to just regionally, Americas is interesting because, of course, Americas includes both North America and South America that look actually very differently. But overall, then, when you merge the two, it looks very similar to the global effect. If you divide it up, it looks closer to the high-income country and middle-income country graphs that I showed. But it highlights that, okay, looking at regions important, and the kind of region, looking at regional characteristics. Europe is this was the most stark model that we saw. So it does, in coincidence or not, right at the time of the Framework Convention on Tobacco Control being adopted, that's when a previously actually increasing trend suddenly did become a lowering trend. Might be due to this, might be due to the European Union accession rules, which required many Eastern European countries to adopt stricter tobacco control regulations. Lots of reasons, but Europe has done well in this time. Asia, the opposite, and there's so many more people who live in Asia and so many more vulnerable people who live in Asia that we should be really worried about this opposite result. I did lots of different robustness checks in order to bring confidence into this. And we've published results for all of these robustness checks in a web appendix, so you can interrogate them into great lengths. So strengths. Overall, this analysis that I present and the sort of unfortunate findings are not so exciting, or maybe it's exciting, but it's not very satisfying if you're interested in either global health or interested in the effects of international laws. Yet, its strengths of this analysis is that it is the most complete, verified, non-modeled tobacco consumption dataset yet compiled, and now publicly available for anyone to use and interrogate. Second, we did quite extensive triangulation of our results, most notably because we actually did 2 complementary quasi-experimental designs. And the third is that all those robustness checks mean that at the least, to the extent that there was going to be a statistical finding, there should be at least some confidence that the 52 most obvious ways of finding that results did not actually yield that kind of global effect that we were hoping to see, but revealed some very interesting regional patterns that need to be further analyzed. Limitations, there's quite a few. So we are missing data for different countries, most countries actually in the world, except that all those countries for which we're missing data account for less than 5% of global consumption. So in that respect, to the extent that we care about the overall global finding, the 5% would not have influenced that. Second, we only investigated cigarette consumption. So actually, whenever I've been saying tobacco consumption, our data is actually only for cigarettes, excluding, for example, tobacco that's smoked, water tobacco, nargila, and other forms of tobacco around the world. In some countries, that actually represents quite a bit of tobacco consumption. More time may be needed for treaties to have effects. We only looked really at the first decade of the treaty. So to the extent that if one believes that the findings of treaties take time, and of course they do, maybe this treaty, maybe its greatest fruit will be born after that 10-year period. But at the very least, our study covers the 10 years. And then there's one major weakness for each of the 2 quasi-experimental designs that we used. In the interrupted time series analysis, it assumes that underlying time trend in the absence of an intervention. Now, many times taking a ruler and drawing it out makes sense, other times not. And I think in this case, I would say maybe that's not the most reasonable assumption. Why would we assume that a ruler would represent our future? So I think that's a big reason then why we also did this more innovative design, the in-sample forecast event model. But that too has a weakness, which it assumes constant association between cigarette consumption and the model's explanatory variables, both before and after. So it's assuming that the relationship that cigarette consumption would have with, let's say, economic growth before 2003 would be a constant relationship to cigarette consumption after 2003. I think that's much more justifiable, and or it's certainly a limitation, but it's makes good sense, and certainly is less crazy assumption than is often made in various models like this. So implications, I'm just going to quickly share, because we can talk more about this during the questions and discussion, is that I think from my perspective, this really highlights the gap between efficacy and effectiveness. And I often have this when I'm talking to my law students who assume that, okay, if a law is enacted, of course it has effects. And maybe in a national context where there's a national police force and there's courts and there's various things where citizens might very much expect to have consequences when they might not follow the rules. Maybe there it's a bit more reasonable to have that assumption. But internationally, where yes, we have courts, but our International Court of Justice hears up to 4 cases per year. This was unlikely to ever get in front of the International Court of Justice. And we don't have the same kind of global police force and such. So international law is, in that respect, it's much more of a political question about whether we bridge that gap between efficacy and effectiveness, and really, really important one to think about. But not just thinking about in the difference between domestic and international, also thinking about the differences between high-income and low- and middle-income countries. Because for treaties to have effects, it's clear that treaties actually need to be not just enacted in Geneva, New York, wherever, and not just even formally ratified by parliaments or the executive. We need them actually implemented within countries. We need countries to actually adopt those proven tobacco control laws and policies that work. And yet, when thinking of a treaty like this, it might be the case that, and is certainly actually the case, that low and middle income countries would not have the same bureaucratic and implementation capacity as higher income countries. That's a generalization, but it's very often true. The second is that it forces us to think about treaty design. So have we designed the Framework Convention on Tobacco Control for impact? And so if you're a lawyer, for any of the lawyers in the room, you might think, okay, if I'm designing a treaty for impact, I'm thinking enforcement mechanisms, I'm thinking sanctions, I'm thinking adjudicative processes, I'm thinking monitoring mechanisms, very, very few of which are located in this treaty. This was not a treaty designed with those various mechanisms that might have encouraged compliance. And third is just at the same time, we have to think of that the world changes, and in turn, our legal tools, our various regulatory tools have to change along with it. So this was a time of great trade liberalization, which allowed for more efficient tobacco trade across countries, and indeed means of evading tobacco controls. So the kinds of tools we need change with the times. The other thing is honing in on high-income countries versus low-income countries, we do see the potential importance of the European Union in this data, in the sense of the European accession rules that, as I said, required new member countries to adopt strict tobacco control regulations, as well as, unfortunately, this also, within this data and this finding, we see the consequences of increasing affordability of tobacco in low and middle income countries. And by that, what I mean is that incomes in low and middle income countries are generally rising faster than tobacco prices. So then when you think of the cost of tobacco as a percentage of income, it's actually going down, unfortunately, whereas we need it to go up. So for example, even if we raise tobacco taxes, we need to raise it faster than incomes, not just, so just the fact that tobacco tax is going up, that's not enough. It needs to rise at a rate that's faster than incomes are rising. Bringing this together, we have a bit of a wicked story in a sense that I think is it's our hypothesis, but because on one hand we have this sort of these contradictions, several contradictions at play, and so what we see really, and what explains all this, is we have varied implementation of tobacco control policies following the Framework Convention on Tobacco Control. You have this international treaty. It encourages some countries to act. Other countries don't act as quickly. And so what you have is a situation in the world where some jurisdictions are more friendly to selling tobacco than other jurisdictions. And so when you have companies that are actually that have to make choices as where they put their marketing dollars and their focus, they can easily shift between countries. And so what we think we've seen here is a market equilibrium effect, whereby tobacco industry, increasingly having an unfriendly environment in certain mostly high-income countries, have very quickly shifted their attention and energies to low and middle-income countries as a result of a less unfriendly environment that they have, that are more friendly environment, and particularly in Asia, which is where we saw a lot of this. So with that, then the conclusion is maybe they're not so controversial, even if the finding kind of is. The conclusion is that, okay, we need to then rapidly scale the implementation of these key tobacco control policies, particularly in low and middle income countries and in Asian countries, and we have to more assertively counteract the transnational activities of the tobacco industry, which are exactly what, for example, the World Health Organization has been calling for quite some time. So in that respects, this evaluation highlights that, okay, this mechanism, this treaty, maybe we can't find an effect. But the same actions that we would need whether we have the treaty, which is to implement these policies, counteract the industry, is indeed the exact same thing that we have to do. I think, though, where this does leave us with some questions, and we can talk about this in the discussion, is around for the future. So I'm not saying that now that we have a Framework Convention on Tobacco Control, I'm a big believer. Let's make full use of it. It's this instrument, it's there, it's a powerful normative statement. Now that we have it and the costs have been invested in building it, yeah, let's make use of it for all that we can for tobacco control. What I'm doing is raising the question of, in 1995, when this was initially called for, and then in 1999, when this was made a key plank of Gro Harlem Brundtland's plan as a Director General of the World Health Organization, was this the right mechanism in order to tackle the extremely important challenge of tobacco control? And maybe, based on what information was known in 1999, I would say the right choice was made back then. It was a very interesting and important idea that needed to happen, and it's great that it happened. I think, though, in light of this evidence, if we had this evidence back in 1999, my conclusion would be no. This maybe was not the most effective or cost-effective mechanism to drive progress on tobacco control. Instead, I probably would have tried to, based on this, and thinking of the broader evidence, try to think through, okay, what are some other ways that we can drive implementation of tobacco control, especially in countries with less implementation capacity, and frankly, especially looking at tobacco taxes, which has been shown to be the #1 effective way of reducing tobacco consumption. So with that, thank you very much. I look forward to the discussion.
Thanks a lot, Stephen. So, what were your reactions and comments?
Yeah. So thank you very much, Stephen. I think this is a very fascinating study. It's well designed, well conducted, and published in a high impact journal. So it's a model of very good research. So congratulations with that. It's also very important, I think, in Norway, because Gro Harlem Brundtland, our former prime minister, was the director of WHO, and the Tobacco Convention is often seen as her legacy. So we tend to believe that this was extremely important and a model to follow. So a critical assessment of that is, of course, very welcome. Tobacco is the #1 public health issue in the world also. Around the turn of the century, there was a lot of discussions about the impact of tobacco consumption, and the great statistician Richard Peto and the Australian demographer Alan Lopez, they estimated that if we do nothing and the trends continue and the population size increase as estimated, the counterfactual, what would happen if we do nothing would be 1 billion deaths in the 21st century. Of course, it's hard, maybe that's hype, it's hard to estimate the counterfactuals, but it's the #1 issue in global public health. It's also very important because those of us who believe in evidence-based policy and look for good instruments to achieve change. We want to know, and policymakers want to know, and we as researchers want to know what works and what doesn't work. And you typically have different instruments. Of course, you have financial instruments, like you talked about, incentives, taxation. You have laws and regulations. You have influencing practitioners in the field. So in medicine, we often talk about using guidelines, training people, doctors to do the right things, etc. So we are always looking for policies that work. But I'm also very disappointed because in a way, it shows that global laws and global regulations in this particular instance didn't work. So in a way, the good guys didn't win, the bad guys won. So that's one take-home message, I think. But also it highlights the difficulties of showing the effect of global law. It also shows the difficulties on documenting the effect of public health interventions. So I want to talk a little bit about the methods, or thinking about the implications of the methods. Because you distinguished very clearly between efficacy and effectiveness. So we know that laws and regulation and policies to reduce tobacco work, the particular interventions. But global regulation, the Tobacco Convention, is a much more complex intervention, as you showed in the logic model, with a lot of mechanisms that have to work together in the same direction to achieve change. And I've seen the same in standard medical research. So we know that people with hypertension, they have a higher risk of stroke and infarction and death. And there are very good randomized trials that show that if you reduce hypertension, you reduce the risk. If you reduce cholesterol, you reduce the risk. If you advise people on stopping smoking, you reduce the risk. But when you put all these single interventions together in a package and you test it out, if this is implemented by primary care physicians, and you there have been several randomized trials that try to measure the impact of a complex intervention, putting these single interventions that work together, comparing it with primary care doctors who do nothing or as they always did, and it's impossible or very hard to document that effect. So I think one interesting issue for discussion would be, if we are interested in evidence-based policy, identifying the right interventions, the right policies, should we continue looking at, and should the standard be that we have to prove effectiveness of complex interventions? And should we, and I'd like to ask you, will you continue with this kind of research, or should we do more admitting that we have to break down this wicked problem into smaller problems, big enough, and do use other designs, like the Nobel Prize winners of economics, the Poverty Action Lab, Esther Duflo and Michael Kramer and Banerjee. They have kind of taken a different approach. They're interested in how can we reduce poverty, and they looked at small mechanisms and trying to show what the impact is, and they can find very positive effects. And then the idea would be to put all these small interventions together and believing that they work. What you show is maybe that belief is misguided. So I'll end here. A lot of thoughts. It's very stimulating having this kind of presentation and such excellent research. So few of my reflections, immediate response to your talk.
Right. Yeah, thank you very much. If I can,
you can respond.
I'll just quickly say, I think that you hit on exactly why this is disturbing in a sense. And I think it's, forgetting about this particular treaty, or even forgetting about tobacco control, what it highlights is that it's merely knowing or assuming a relationship between the intervention potentially working, or if only it was implemented, and then maybe we'll get an outcome that we want. Making that assumption can actually be dangerous, in the sense that it's not only not necessarily true, because it can break down along the way, but also that it distracts us from other things. So you gave the perfect analogy with thinking of the different drugs that individually, yes, if properly used for the right people in the right context, in the right way, those different interventions will work to reduce cholesterol and such. Same with tobacco control laws. Tobacco control laws that are ratified, implemented, funded within countries will work. And it's been shown with thousands of studies that they work. But big difference between having a law that's actually working and fully implemented versus one that's not in the exact right way for that particular context. Really highlights we can't just, if what we care about is outcomes, and that's my interest. I know there's many other people care about other things, but if you're interested in driving outcomes, you actually do need to think of the multiple steps along the way, and can't just hope that it happens. And that's scary, right? Because a lot of what we do in international, in global governance and in global health makes quite a lot of assumptions along the way. We need to be looking at those and really interrogating, can we make those assumptions? Yeah.
Did you want to follow up or?
One quick question. So one positive message could be, it's very nice to see when you look at the predictions for high-income countries and the actual decrease, and you found a significant difference there. So one positive message could be, we can learn from the best performing countries, and if you have effective laws and you have enforcement mechanisms and probably a lot of other mechanisms as well, it works. So other countries can learn from the best performing countries. Would you agree with that message?
Yeah, I think it's even more evidence that, yes, when these policies are fully implemented, they work.
Yeah.
So it's even more evidence on top of those thousands of studies that it works. But I think also what it does point to those who are designing future treaties on various issues or protocols to this framework convention, that we need to think of market equilibrium effects. And that, I think, is a really scary part of this, which is that we might, just by adopting a set of rules for the world that, when implemented, should have positive effects or even will have positive effects, if they're not rolled out at the exact same time because of either, well, for various reasons, but including capacity issues, then you might actually cause equilibrium effects that cause a lot of harm to people who are already some of the world's least well off. And so then there's the equity peril of the way we design treaties. So it's, and that's the timing could actually cause permanent damage, because something like tobacco, well, specifically the nicotine within tobacco, makes this one of the most addictive substances. So in some respects, yes, maybe it's only a time lag, but for something like this, the time lag has now hooked millions of people on a product that's killing them.
And to follow up on that, I think one of the things that you really highlight is the importance of also including trade issues more in the conventions, that's really important. But also, and also, I think what I really find striking is sort of the way in which the incentive effects that you're pointing to now are also highlighted in both in terms of where industry moves, but also, and that's outside because you only look at cigarette consumption, but if we look at Norway, for instance, tobacco consumption has shifted dramatically from cigarettes to the snus, the chewing tobacco, which isn't chewing anymore, but which is extremely widespread, and also e-cigarettes, which I probably is also outside.
Outside.
Yes. But and that's a big discussion because it is moving towards less harmful in some ways forms of tobacco consumption, particularly for the environment around. But so that's also a discussion where sort of it's the consumption, but it's also the nature of the tobacco, which in some ways, in some cases, is also more harmful in less regulated countries. That it's more addictive and it's more harmful cigarettes.
Except that the creation of these other alternatives, you'd expect. So e-cigarettes were invented in 2003, the same year that the Framework Convention was adopted. So in a sense, you'd expect then, okay, in light of these new things, more people would have shifted from cigarettes to these other products, yet we still didn't find an effect on the 2003 of that time period. So in a sense, those developments further, because you're right, it's so important to think about tobacco control in that broader context of these various products, but at least from a statistical perspective, it further deepens.
But I would be really interested in whether the work on the Tobacco Convention and this whole process that you show on the timeline is also part of what stimulates the developments within the tobacco industry. We don't have that much time, so I'll just open up and take questions if there are any, or comments, and then we can continue the discussion. Anja, but just present yourself briefly.
Thank you. My name is Anja Ariansen. I'm a postdoc from the sociology department. I really enjoyed your presentation. I think that the patterns you show are very similar to that of dietary risks, that the importance of dietary risks have decreased in high-income countries, but they're increasing in the low middle-income countries. So I think it's very nice that you see tobacco, but I think that we need to think that there are several risk factors that need to be addressed, probably in the same way, maybe. And also I think it's a bit concerning that when tobacco use is decreasing in the United States, they have at the same time they have an increase in this use of opioids or really hardcore painkillers on prescription medicine. So I think that it seems to me that the companies are very sensitive to the environment, that they invest and promote the whatever they have that is very addictive and very poisonous to the different countries, so that they're constantly under the radar. We're kind of always. Like you're saying, it's always a lag. We're always too late in a way.
Yeah.
So I think we must, I think we must look across sectors and across some countries, and that's very difficult in a way. But thank you. Yeah.
No, it's a great and important comment. And just to emphasize, companies are very responsive to the changing world. Our international laws are not.
Yes, Solomon. Just
maybe I can just speak louder.
Oh,
but it's easier, then we can get it on this. This is streamed as well. So
Okay. My name is Maxime Compaoré. I'm a special advisor at the Norwegian Cancer Society, a civil society organization. Thank you very much for your interesting presentation. As I told you before the start of the session, I followed the webinar you organized back in May. I've read the article for insight, and I think it's really interesting for policy advocacy purposes. But in the opposite of one of the panelists, I don't remember your name, we are not disappointed. We are energized because we understand why things are not working. As policy advocates, we consider the FCTC, the Framework Convention on Tobacco Control, as seatbelts, for example. If you ask the question, does seatbelts reduce road fatalities? The answer would be yes, but you have to use them. Or do condoms prevent pregnancies? The answer is yes. But the same answer is valid. You have to use them. If you don't use them, then it doesn't work. And for the FCTC, we understand that it has taken a lot of time to come to sort of the starting point when parties decide, okay, we are going to implement them. Because starting from the adoption in 2003, it is until 2014 or 2012 when the last guidelines, because you have to interpret the law, the international law, for people mainly in low income countries that needed technical assistance to build their tobacco control infrastructure, to understand it and then get the assistance before they start implementing it. So it is only in 2012 at COP6 in Moscow that the last guidelines of the convention were adopted. And it was the guidelines for one of the best, the most effective Article 6, which has to do with the fiscal measures were adopted. So it is, one can assume that maybe we have started really implementing the FCTC, starting after 2012. And from the 181 parties, it means 180 countries plus the EU, not all the parties come to the negotiations with the same agendas. We have parties that are there to bring the agenda forward, but there are other parties, which are tobacco-producing parties, who are there to sort of put, to break very hard, put very hard on the brakes. They don't want it to go because they have economic interest in these negotiations. And we see that during the negotiations of the COP. The COP is the Conference of the Parties, the governing bodies of the convention. So these are factors that need to be taken into account. And lastly, of course, we see a very interesting, significant decrease within high-income countries. And for us, it's not very surprising because it depends on the baseline. Where did they start? If you look at, because the study takes into account combustible tobacco, cigarettes, And most of the low-income countries, I have roots from West Africa, from Burkina Faso. Most of these low-income countries, cigarette consumption was not very high. They were using smokeless tobacco in most of the life cycles, whether it is birth, death, and everything they use smokeless tobacco. But cigarette consumption has been gradually introduced very recently. While the high-income countries, you have, they started very high. You had consumptions in Eastern Europe, for example, that were nearing the 50%. So it was easy with some stringent legislation to see the decrease. While in the low-income countries, if you take the combination younger population, heavy marketing, and availability, then it is supposed to come to a certain level where the awareness is raised about the negative consequences of tobacco before people can start to really focus on putting in place real measures to tackle the problem. But another point I would like to raise is you mentioned trade negotiations. And I think it is very important because we have high-income parties which is putting in place very, very stringent legislations at home in their own countries, but putting pressure in low-income countries so that they can open their markets for tobacco products because it generates income. It's good for business.
Yeah, you often see governments on the Ministry of Health doing one thing, Ministry of Trade or Agriculture doing something else.
Yeah, I was coming to that because yesterday, sitting in a train, I was reading the Norwegian news, and we have Virke, who's suggesting that, okay, we need to reduce prices of tobacco or cigarette and other products because Norway is losing a lot to Sweden. You have cross-border purchasing of these products. So it's not very good for business. So they need, some are advocating for, because here in Norway, the pack of cigarettes, for example, costs, I think if you go to the grocery store, you can buy it at 130. I live in Ås, about one hour from the border, Swedish border. If you just drive there, you can buy it at 63, or you can purchase it online. So there are major loopholes and the difficulty of trade harmonization between neighboring countries that make it very difficult for legislation to function as it should. So we have the challenge. We know it is challenging. We know where the shoe pinches. So as I said, as a civil society representative, we are NHS. We know that we have a lot of work needs to be done. And we're going to focus on that and hold the governments accountable to their responsibility of protecting public health. Thank you very much.
Thank you very much. If there are anyone else who have something they want to ask, it has to be now because we need to sort of round off. But we can take a couple of more comments if anybody has any. And we're all satisfied. Very good. So I'll give the last words to you. Just respond and sum up.
I'll just say if I can respond to the comments. There's lots of challenges that remain, and it's why tobacco control and civil society focus on tobacco control, government action on tobacco control is more important now than ever. So 8 million people die every year from tobacco consumption. 600 people died during this last hour from tobacco. That's at least 3 airplanes, right? Or about 3 airplanes dropping from the sky. So just within this hour. But how I'm so pleased to hear, though, as a researcher, that this study has energized and can energize, because indeed that's the intention of this. And I think that's the power of science and why we need to bring a scientific lens on these types of issues. Because if we really want outcomes, and I think everyone here and hopefully everyone listening to this online really wants to have better health outcomes around the world. And as a result, then we need to take evidence-based policymaking and action quite seriously. And that requires us to have the maturity and intellectual honesty and commitment to actually sometimes put a critical lens to some of the strategies that we've used to see, is this the right strategy? Was it the right strategy? Would we do it again next time any differently?
Okay.
And so in that respect, how amazing that if something like this could be like, okay, maybe we haven't yet found the effects, but maybe they're still coming. But in any event, the action now is just as important, if not even more important, in light
It
of
helps
the
us see the problem
It helps us see the
and
problem.
and the possibilities, which I think is truly amazing and extremely inspiring. So thanks a lot. And
Thank you
thank
very
you as well. And thank you.